Greetings. Let us talk about clinical features of cirrhosis of liver with portal hypertension. And these are my acknowledgements, and please read this notice. And when we see a patient with liver disease, we need to ask ourselves a couple of questions. First, is the liver normal? Or if there is any injury or hepatitis, and is that going on for a long period of time, several months, typically more than 6 months, in which case you would consider chronic liver disease. And once the liver injury and inflammation results in cirrhosis with fibrosis, especially bridging fibrosis from portal vein to portal vein or portal vein to central vein. And in that case, you consider the diagnosis of cirrhosis of liver. So it's important to look at this picture, uh, normal hepatitis, chronic hepatitis with fibrosis, and then cirrhosis. And cirrhosis nowadays is being considered as compensated advanced chronic liver disease. Cirrhosis is a diagnosis you make based on liver biopsy, which demonstrate distortion of the liver architecture, the lobular architecture, fibrosis, especially bridging fibrosis from portal triad to portal triad to central vein, and recognition of regenerative nodules. And currently, there is a lot of interest in coming up with the same diagnosis of cirrhosis without the liver biopsy by using blood tests to measure fibrosis indirectly and special scans to look at fibrosis, or ultrasound or imaging studies to look at the effects of portal hypertension, especially portosystemic collaterals. So with that background, when you see a patient with suspected liver disease in the hospital or in the clinic, when you approach a patient, it's always best to start looking from the hands. By looking at the hands, you make the patient more comfortable. And what I try to do is I look at the palms to look for palmar erythema. And when you see palmar erythema, you should be thinking, is this patient having cirrhosis? And then you ask the patient to turn his hands and look at the dorsum and especially the nails. And if the patient has white nails, otherwise known as Terese nails, you should be thinking of possibility of chronic liver disease and cirrhosis. From the hands, when you look at the face, look for spider angioma. And the best way to demonstrate spider angioma at the bedside is take a slide, a glass slide, and press on the spider angioma. The central supplying vein blanches, and then when you take the pressure off, the blood flows from the central vein to the branches. So spider angioma are typically seen on the face, neck, and upper body. And then you also look at the eyes for any icterus. And then as you come down to the chest, gynecomastia. And as you come down to the abdomen, you should be looking for veins around the umbilicus, especially caput medusae. In portal hypertension, the blood flows away from the umbilicus. Veins above the umbilicus take the blood from the umbilicus to the superior vena cava, and veins below the umbilicus take the blood to the inferior vena cava. So the veins below the umbilicus, the flow is away from the umbilicus, and veins above the umbilicus, the flow is away from the umbilicus. This is in contrast to inferior vena cava obstruction in patients with Budd-Chiari syndrome, in which case you will see flow from below up. So what you do is you take a finger, empty the vein, keep keep two fingers, you keep a finger, empty the vein with another finger, and release the vein, release the finger to see which way the blood is going. That's how you figure out whether the direction of the blood flow. After finding these findings, when you examine the liver, you check for the liver size by percussion, and in cirrhosis, the liver is shrunken. And in the left side, you feel for the spleen. The spleen is usually enlarged, or the splenic telanus is enlarged. And as you go from the abdomen down in a male, you should be checking the testis for testicular atrophy. So, palmar erythema, white nails, spider angioma, icterus, gynecomastia, caput medusae, shrunken liver, splenomegaly, testicular atrophy. These are the findings. You may also notice in alcoholics parotid enlargement, and patients with cirrhosis, as the disease advances, they lose muscle mass. So atrophy of the muscle is another finding. I hope this is helpful, and thank you.